Hello everyone, my name is Allison Neal. I'm a senior at the University of North Alabama where I am a social work major. I am doing this video assignment for abnormal psychology. Today I will be discussing tic disorders. We will talk about the symptoms, prevalence, gender, age of onset, course of the disorder, origin, methods of treatment, and we will also watch videos of individuals who have this disorder. First of all, what is a tic? A tic is a sudden, rapid, recurrent, non-rhythmic motor movement or vocalization. There are two types of tics. There are motor tics and there are vocal tics. Motor tics include head and shoulder movements, blinking, jerking, banging, clicking fingers, touching things or other people. They don't always, they tend to appear before vocal tics, but they don't always appear before vocal tics. It's not always the case. With vocal tics, it sounds like coughing or throat clearing or grunting or repeating words or phrases. A lot of the times people who have vocal tics, they curse a lot unintentionally, and it's usually a random outburst of a curse word, but it does happen a lot, and I noticed a very wide trend of this. These are categorized into two categories of tics. You have complex tics and you have simple tics. Simple tics are sudden fleeting tics using very few muscle groups, so it can be nose twitching, eye darting, or throat clearing. And the complex tics involve coordinated movements using several of the muscle groups. This is hopping or stepping in a certain way, gesturing, or repeating words or phrases. There are several different types of tic disorders. Firstly, we're going to talk about one that is more well known, and that is Tourette's disorder. I'm using DSM-5 to list the criterion for all of these disorders. So firstly, both multiple motor and one or more vocal tics have been present at some time during the illness, although not necessarily concurrently. The tics may wax and wane in frequency, but have persisted for more than 1 year since first tic onset. Onset is before 18 years of age. The disturbance is not attributable to the physiological effects of a substance like cocaine or another medical condition like Huntington's disease or post-viral encephalitis. I will now be inserting a video of a young lady on TikTok that I came across who has Tourette's disorder, and she likes to upload kind of her day in the lives and stuff like that. So this is an example of what Tourette's disorder looks like.
Haggis! Bob the Builder. Fuck off right now, Bob the Builder. A beetroot. A beetroot. A fucking beetroot. What are you laughing at?
You and your fucking beetroot.
I don't even really like beetroot.
I love it.
A beetroot? Who said that? Tourette's. Tourette's. Tourette's.
Oh, sorry. True.
It's the chickens, Mrs. Tweedy. They're on to summit.
Nextly, now that we know what Tourette's disorder looks like in someone, there is the next tic disorder called persistent, which is chronic motor or vocal tic disorder. And like I said, once again, I'm reading off the DSM-5 criterion for these disorders. So if I'm looking up, that's why. Firstly, single or multiple motor or vocal tics have been present during the illness, but not both motor and vocal. The tics may wax and wane in frequency, but have persisted for more than 1 year since first tic onset. Onset is before age of 18. The disturbance is not attributable to the physiological effects of a substance like cocaine or another medical condition like encephalitis. criteria has never been met for Tourette's disorder. So in order to have this tic disorder, we have to be sure that they don't have Tourette's. I don't have a video of an individual with this disorder, but we will move on with the next tic disorder. There is provisional tic disorder. This is also called transient tic disorder. The criteria for this is single or multiple motor and or vocal tics. The tics have been present for less than 1 year since first tic onset. Onset is before age 18 years. The disturbance is not attributable to physiological effects of a substance like cocaine or another medical condition like encephalitis. Criteria has never been met for Tourette's disorder or chronic motor or vocal tic disorder. I do have a video of an individual who has transient tic disorder, and I will insert that here so that you can see what that looks like.
Fuck you. Goodbye. Wow.
Shadows settle on the place that you left.
Fuck you. Fuck you.
Our minds are
Wow.
troubled by the emptiness. Destroy the middle, it's a waste of time. From the perfect start to the finish line.
Nice cock.
And if you're still breathing, you're the lucky ones.
Oh.
'Cause most of us are heaving through corrupted lungs.
Now that we know what transient tic disorder looks like, let's dive into the symptoms and ages for this disorder. The symptoms of tic disorders can vary greatly given the disorder itself or the individual with the disorder. The onset of disorders usually is generally before age 18 across all the differing disorders, so that generally doesn't change. Now let's talk about the prevalence and the gender studies of the disorder. They're common in childhood, but transient in most cases. The estimated prevalence of Tourette's disorder ranges from 3 to 8 per 1,000 in school-age children. Males are more commonly affected than females, with the ratio varying from 2 to 1 to 4 to 1. National survey in the United States estimated 3 per 1,000 for the prevalence of clinically identified cases. The frequency of identified cases was lower among African Americans and Hispanic Americans, but this also might be related to the access and care given. The development and course of tic disorders is now what we will speak on. The onset of tics is typically between ages 4 and 6 years. Peak severity usually occurs between the ages of 10 and 12 years, with a decline in severity during adolescence. Many adults with tic disorders experience diminished symptoms, though a small percentage of individuals will have persistently severe or worsening symptoms in adulthood. Tic symptoms manifest similarly in all age groups and across the lifespan. They wax and wane in severity and change in affected muscle groups and vocalizations over time. As children get older, they begin to report their tics being associated with a premonitory urge or a somatic sensation that precedes the tic, and a feeling of tension reduction following the expression of the tics. Tic associated with a premonitory urge may be experienced as not completely involuntary in that the urge and the tic can be resisted. An individual may also feel the need to perform a tic in a specific way or repeat it until he or she achieves the feeling that the tic has been done just right. The vulnerability toward developing co-occurring conditions changes as individuals pass through the age of risk for various co-occurring conditions. For example, prepubescent children with tic disorders are more likely to experience ADHD, OCD, and separation anxiety disorder than are teenagers and adults, who are actually more likely to experience the new onset of major depressive disorder, substance use disorder, or bipolar disorder. Now we will speak on the origin of these tic disorders, which unfortunately the exact cause of these are unknown, but important risk alleles for Tourette's disorder and rare genetic variants in families with tic disorders has been identified. Brain chemistry also seems to be really important in the role of this, especially the brain chemicals glutamate, serotonin, and dopamine. As far as methods of treatment are concerned, treatment depends on the type of tic disorder and its severity. In many cases, tics tend to resolve on their own without treatment. With severe tics, though, that interfere with daily life, they can be treated with therapies, medications, or deep brain stimulation. I saw a lot of cognitive behavioral therapy kind of methods being mentioned in the literature I was reading. Overall, individuals with this disorder really just have little to no control over their tics, and they feel burdened by them most of the time. I'm actually going to insert a video from the young lady that we saw earlier where she did a video kind of signifying what she goes through on an everyday basis and how it feels to have Tourette's disorder. So I hope you guys enjoyed, and I hope you learned something today, and I will talk to you later.